Why do bipolar medications cause akathisia? Imagine feeling restless all the time, like you just can't sit still no matter how hard you try. That's what akathisia feels like, and it can be a frustrating side effect of some bipolar medications. It mostly happens because these drugs interfere with how your brain controls movement. Many medications used in bipolar disorder, especially antipsychotics, work by blocking dopamine receptors in the brain. Dopamine is a key chemical that helps regulate movement and mood. When these receptors are blocked, dopamine can't do its job properly, leading to symptoms like restlessness, an urge to move constantly, and an inability to stay still. First-generation antipsychotics, which strongly block dopamine receptors, tend to cause akathisia more often than newer, second-generation antipsychotics. However, some second-generation drugs can also lead to this side effect. For example, aripiprazole is a medication that partially stimulates dopamine receptors but can still cause akathisia in some people because of its complex effects on dopamine and serotonin. In addition to dopamine, other brain chemicals are involved. Increased activity of norepinephrine, which is related to alertness and stress, can contribute to feelings of restlessness. Serotonin, another neurotransmitter, also plays a role. Some medications that increase serotonin levels, like certain antidepressants used in bipolar treatment, can inhibit dopamine releases and lead to akathisia. That's why some bipolar patients on antidepressants might experience this side effect too. So, in simple terms, bipolar medications cause akathisia mainly because they block dopamine signals in parts of the brain that control movement. This disruption makes it hard for the brain to coordinate muscle activity normally. The involvement of serotonin and norepinephrine adds to the complexity, making some people more prone to this side effect than others. The risk depends on the specific medication, the dose, and how sensitive each person is. Managing akathisia often involves adjusting the medication, lowering the dose, or adding other treatments to help balance these brain chemicals and ease symptoms. Understanding why this happens is important because akathisia can make people feel very uncomfortable and may lead to stopping their medication altogether. For healthcare providers, choosing medications with a lower risk of causing akathisia and monitoring patients closely helps improve treatment adherence and quality of life. Always remember, if you experience this side effect, it's essential to talk to your doctor. They can help find the right balance to manage your symptoms safely and effectively.